Welcome to today's webinar titled Enrollment Options After TRICARE Open Season. We are thrilled to have with us today Mark Ellis, Senior Health Program Analyst, TRICARE Policy and Benefits Office with the Defense Health Agency. Without further delay, I will turn things over to Mark Ellis.
Thanks, Dan. Hi, this is Mark Ellis at the Defense Health Agency. I'm also joined with colleagues here from the Defense Health Agency, from customer service and some other of our program managers who manage specific TRICARE health plans who help me answer your questions at the end of the formal presentation. So let me get the legal disclaimer part done. So on slide number 2, the appearance of hyperlinks does not constitute an endorsement by the DoD of this website or the information, products, or services contained therein. For other than authorized activities such as MWR and military exchanges, websites, the DoD does not exercise any editorial control over the information you may find at these locations. Such links are provided consistent with the stated purpose of this DoD-sponsored webinar. All right, I got the legalese stuff done. So the links to websites that I'm going to talk about and are displayed on our presentation slides for today's webinar, those are DoD-approved websites, and they're where you will find official information about the TRICARE program and how it works and the benefits thereof. Moving on to slide number 3, here's what we're going to talk about today. I'm going to talk about open season for just a little bit. Give you some good news that open season is a little bit longer than you thought. And then I'm going to talk a little bit about the differences between health plans to give you some insight on how you might want to make a choice between TRICARE Prime and TRICARE Select. And then I'm going to talk about the enrollment options starting 1 January 2019, next year's open season, and how you might change your TRICARE health plan coverage during 2019 with a thing called a qualifying life event. So with that, let's move on to slide number 4. So the good news is open season has been continued for TRICARE to the end of calendar year 2018. And so you may ask, hey, Mark, didn't you say it ended on the 10th of December? Yes, we did, but and that was consistent with the open season for the FedVIP dental and vision insurance. But the fact of the matter of it is the law that created the open season concept for TRICARE program said that calendar year 2018 was an enrollment grace year. So you technically have until the end of December to make a change to your existing TRICARE coverage or to enroll in coverage for coverage beginning on 1 January 2019. Just a heads up, TRICARE open season was just not a calendar year 2018 thing. This is going to happen every year, and it provides an opportunity for TRICARE eligible beneficiaries to elect to enroll in or change their TRICARE Select or TRICARE Prime coverage. That's going to happen technically from Monday of the second full week in November to Monday of the second full week in December each year. When you make an election for coverage in an open season, the coverage will take place on the 1st of January of the following year. So on slide number 5, right now through the end of December, if you need or like to make a change to your TRICARE Prime or TRICARE Select coverage, you have 3 options. If you like what you got, if you like Prime and you're enrolled in it, or if you're enrolled in Select and you like it, don't do anything. We're going to automatically roll over your enrolled coverage for another year through 2019 as long as you're eligible. Or if you haven't enrolled in TRICARE Prime and you're Select and you're eligible to do so, we certainly encourage that. It's not mandatory. You don't have to take it. But if you want TRICARE coverage that when you see a provider downtown and you want TRICARE to help pay for the cost of that care, you should seriously consider enrolling in a TRICARE Prime or Select plan. So you can do that now. And then finally, the third option is you can change the plan you're currently in. If you're thinking, yeah, I think I'd like to go to Select, I'm in Prime, or vice versa, now's the time to do it. You can also make changes to whether or not you have individual coverage or if you have family coverage. You want to add a child, you got divorced and you need to drop somebody, that sort of thing. www.tricare.mil/open season is the authoritative source for all TRICARE open season questions you may have. You can certainly call your regional contractor, and we'll talk about their phone numbers at the end, but certainly the authoritative source of something that's easy to read and understand. Thank you, my DHA.com colleagues. TRICARE.mil/open season. On slide 6, let's talk a little bit about the differences between TRICARE Prime and TRICARE Select. This often is a cause of concern to beneficiaries. They've been enrolled in one plan so long, they're a little unsure. So let's talk about the key differences. So let's first talk about TRICARE Prime on the left column. So it's an HMO option, a health maintenance organization option. Think about this as the managed care plan. You have less control in where you go to get care when you sign up for TRICARE Prime. So you get most of your care either provided by or your PCM arranges for care when he or she can't provide the care you need. So you typically need a referral for specialty care. In some instances for high dollar or highly complex issues, think like heart transplant, solid liver, inpatient kind of care, that's planned care, you need prior authorization. And then you receive care from an established network of providers. If you go outside of that network of providers, it will be at a higher cost of care. The good news is with TRICARE Prime, no deductible. A deductible is where you have to pay the first X amount of money before TRICARE helps pay for your care downtown. Co-payments do apply, so you know in advance when you go see a civilian provider, you know how much your out-of-pocket expense is going to be. That doesn't apply, by the way, to active duty service members. And the other thing that's not on the slide I'll mention for TRICARE Prime for retirees, there are enrollment fees in lieu of having a deductible. All right. On the other hand, looking at TRICARE Select, on the right-hand column, TRICARE Select is a self-managed preferred provider option. I want to emphasize the self-managed point because it's in direct difference than the TRICARE Prime option, which is largely managed by your health plan and your PCM. So under TRICARE Select, you get to choose to see any authorized TRICARE provider. Referrals are not required for most services, almost none. Prior authorization for inpatient care and the high dollar, highly complex care is still required. However, you can receive care from any TRICARE authorized provider. You may have a little bit higher out-of-pocket expense because you have a deductible. And generally speaking, when you see a network provider, your co-payments are a little bit higher, maybe 10% to 15% higher than if you were enrolled in Prime. And you can see providers in or out of the network. If you see providers out of the network, then you'll have a higher out-of-pocket expense. As I said, there is a deductible, $150 for an individual, $300 for a family. It's less if you're an active duty family member, is less. If you see network providers, you have a co-payment in some instances. Otherwise, you'll have what is a cost share. A cost share is a percentage of the TRICARE allowed amount that's authorized to be paid to providers for that service. And so if the TRICARE authorized amount or the TRICARE okie dokie amount is $100 and you've already fulfilled your deductible, if you're a retiree and you see a non-network provider, you'd pay 25% and TRICARE would pay the other 75%, as an example. So in summary, TRICARE Prime is a managed healthcare plan where you have to see designated providers, and if you go outside of that network, you'll have a higher out-of-pocket expense. On the other hand, TRICARE Select has a deductible. It has a little bit more cost, but there is freedom of choice, and you can see any provider that you want as long as they've been TRICARE authorized. So those are the major differences. I encourage you to go to tricare.mil/compare plans. Is a good place to go to get a good look at not only what I've just described, but actually the details of the out-of-pocket expenses that you may have for a particular service. And so, for example, if you have a lot of specialty care appointments, somebody other than a primary care provider, you'd want to take a look at the cost of those and compare them from one plan to another to determine what's the best choice from you. Largely, though, most beneficiaries, if cost is not the overwhelming issue, it's really the issue for most beneficiaries we find is whether they'd like their care managed by somebody or they'd like to manage themselves. All right, moving on to slide 7. The open season doesn't apply to certain TRICARE health plans. It does apply to TRICARE Prime and TRICARE Select. It doesn't apply to what we call in the trade the premium plans. These are TRICARE health plans where beneficiaries have to pay a premium in order to enroll in the plan. So for the TRICARE Retired Reserve, TRICARE Retired Reserve, the TRICARE Retired Reserve Plan, TRICARE Reserve Select for the selected reserve members and their family members, TRICARE Young Adult for those who have aged out of TRICARE but they're still under age 26, and the Continued Health Benefit Plan, which is offered to beneficiaries when they lose all entitlement to TRICARE and they need some transition coverage before as they move to the civilian sector. Also, TRICARE Open Season does not apply to TRICARE for Life. Open Season does not apply to TRICARE for Life. Open Season doesn't apply to TRICARE for Life because you become entitled to Medicare Part A and have evidence that you paid Part B, or you are statutorily waived from doing that. Once we have evidence of that, we automatically turn on that eligibility. There's no enrollment forms. There's no need to annually up or change your coverage. TRICARE for Life is an entitlement program as long as you comply with all the rules that Medicare has in order to qualify for TRICARE for Life. All right, so let's move on. So you're thinking to yourself, well, I still have some time before 31 December. How do I go about and do that? So slide 8 talks about 3 options. You can go online and go to the beneficiary web enrollment website on the website listed on the slide. You can call your regional contractor, and the phone numbers are listed there for the East contractor, the West contractor, the U.S. Family Health Plan, and overseas. And finally, you can download an enrollment form and send it to your regional contractor or your servicing contractor. At this point, it would probably be best just to call the contractor and get it done over the phone. If you're a retiree and you have to pay enrollment fees, make sure you have information on how you're going to pay your enrollment fees. We heartily recommend, where financially feasible to do so, that you elect to pay your TRICARE enrollment fees via military allotment from your retired or retainer pay. All right, so those are the 3 ways you can elect to enroll in or change your coverage. Okay, so now let's talk about 31 December is come and gone, and now it's the 1st of January and thereafter. What's going on with that? So come 1 January, the open season period is ended, and you can only elect to enroll or make a change to your TRICARE Prime or TRICARE Select coverage during the annual open season, which I said for 2019 is going to be those weeks in November and December 2019, or after have a qualifying life event. So I'm going to talk a little bit more about qualifying life events and the time frame. So for qualifying life events outside of the annual open season, if you have a qualifying life event, you have 90 days in order to tell us that you'd like to make a change to or enroll in new coverage if someone's become newly eligible. By the way, most commercial plans, it's usually 30 days. Other federal plans, it's no more than 60 days. There aren't many health plans here in the United States that give covered beneficiaries like employees in the civilian sector this amount of time to make an election of a QLE. But we recognize the military population is a little bit more mobile. We also recognize in certain, particularly overseas, the documentation you may need to prove that you have a QLE may be more difficult to get. And so in general, we thought it would be a good idea to give you a little bit more time. So on slide number 10, let's talk about what is a qualifying life event. It's a certain change in your life, such as marriage, birth of a child, retirement from active duty, move to another area, anything where an eligible beneficiary might need to make or want to make a change based on the life circumstances that has occurred within that military family. So, depending on your eligibility, a QLE may allow you to enroll in a new health plan or change your health plan coverage. So, if you want to enroll in or change your plan, first, if needed, you need to update the Defense Eligibility Enrollment Reporting System, DEERS. That's where DoD records whether or not you're eligible for military benefits. And in some cases, for example, if it's a newborn, the TRICARE contractor cannot enroll the newborn in a TRICARE health plan until they've been registered in DEERS, as an example. All right, so, but if you want to enroll in or change your plan, you must update DEERS, make the enrollment change within 90 days of the QLE, and then as appropriate, pay enrollment fees or premiums that are due during the QLE. So on slide 11, let's talk about the key facts about QLEs. The QLE opens a 90-day period for you to make an eligible enrollment changes. The coverage starts as of the date of the QLE. For the address change, we depend upon you to self-attest when that address changes. So when you call the contractor, or if you fill out the enrollment form, or if you do this online through the beneficiary web enrollment for address changes, you'll need to tell us when that was. All right? One other thing that's unique for DoD as well is that unlike commercial plans, a QLE for an addition to the plan only applies to the new addition, so like a newborn or a new spouse. In our case, we thought that it would be appropriate to allow the entire family unit to have an election to change their coverage when one family member has a QLE. Again, the coverage starts the date of the QLE and continues till you lose eligibility or you choose to disenroll. And so let me move to slide 12 and talk about some examples. So on slide 12, you see some of the examples. Some of these are unique to us as military members and retirees. Others are unique to anybody who needs to make a change in their health care coverage. Losing health coverage could also be gaining health care coverage. You can gain civilian coverage through a spouse's employment or your own employment, and you might want to drop TRICARE because you're paying the enrollment fee. That's okay. All these things are examples of qualifying life events. When you contact the contractor, if you go to BWE, you're going to certify that this has happened to you. In some instances, we'll be able to validate those things have occurred. Like again, for example, the example I gave earlier, the contractor can't enroll a newborn till that newborn's been registered in DEERS when you go to a local military personnel office or a rapid site to do so. We have several that we've added this year, mainly dealing with government-directed changes. So if you're enrolled at a military treatment facility and they have less staffing than they've had before, and they need to refer you to have a primary care manager downtown as opposed to the military treatment facility, that will create an opportunity. You can certainly accept the PCM, the civilian PCM network provider, or this would create an opportunity if you want to make a change to TRICARE Select. And then in certain instances, we've not done this yet, but we reserve the right that in certain instances, as military health system reform occurs, we may in the future elect not to offer certain plans in certain areas. And if we do that, that will create a government-directed plan change, and certainly you can elect to enroll in the plan that is available to you at that time. Moving on, there are some special things about overlapping QLEs. So you could actually have more than one QLE over a 90-day period. If you choose the latter QLE, the previous one won't apply. For example, if you lose other health insurance on January 1 and have a child on February 1, with 90 days of either the QLE, you may change your enrollment status based on the loss of the other health insurance or for the birth of the child. If you choose the latter, which was the birth of the child, you can't use the earlier one. So you can choose to elect to do one or the other, but if you choose the latter, that's the one you'll go with. All right. So on slide 14, let's talk about how to make changes to your coverage to a QLE. In most cases, I said the first step is to update your information in DEERS. You can do that in a variety of ways. You can go to a military personnel office. You can call the DEERS support office. There's a website, etc. In most cases, you'll need to provide official documents if you go to a military personnel office or a rapid site. So birth certificate, marriage certificate, of the like, proof of college attendance if it's for for a young adult. There may be other requirements. The TRICARE and the Defense Health Agency do not establish the requirements for the paperwork you need to turn in to establish eligibility for as a retiree or as a family member, whether active duty sponsor or retiree sponsor. The military personnel offices establish that. So if you have any questions about that, we recommend you call the local military office and explain what your circumstances are, and they can advise as to what paperwork you need. And also, in most instances, the military personnel offices, also called the rapid sites, also highly encourage you to make an appointment to come see them, because in most instances, if you show up and announce, you're going to be waiting a while. I do warn you that we still collect the Social Security numbers for both members and family members. It's required by law that we do so. And so if you have a newly eligible beneficiary, a new spouse, a new child, they will register the newly eligible person in DEERS, but they're going to advise you need to return with the Social Security number when it's issued. In some instances, particularly overseas, it may take some time to get the Social Security number issued through the overseas embassy. So let's talk about a couple examples. So on slide 15, the example is moving. So as long as the zip plus 4 is changing, that's the minimum amount that we need. We just need to know that you've actually moved, right? And so if you're relocating to a new country or an overseas region or a new city, moving is a QLE. You get 90 days from the date of the move to make any changes to your TRICARE health plan based on your eligibility or the plan availability. So we don't offer every plan in every city and every country. So depending on your eligibility, and where you are geographically determines what health plans you might have available to you. So when you're moving on slide 16, don't disenroll from your current health plan until you have effected the move. Your current coverage will continue until your enrollment is transferred after you arrive at your new location. Contact your new regional contractor about your upcoming moves so they can begin to transfer your enrollment. In particular, if you are working with your local military treatment facility or with your current regional contractor because you or a family member have extensive healthcare needs and they're helping coordinate that care with MTF providers and with civilian providers in the local community, please, please, please contact your current contractor and ask them to help facilitate the transfer of that information, such as what your specialized healthcare needs are, what the needs are for referrals, what kind of specialists you're currently seeing, and they'll help work with the gaining contractor to help make sure that those referrals are transferred over to the new region and they're finding specialists and other providers in the new location so you can have a seamless move and you don't have any issues with continuity of care for these specialized cases. You should go to the TRICARE Health Plan Finder. It's the URL or website's listed there to see what plans are available and what you may qualify for. Remember, active duty service members can only use TRICARE Prime or TRICARE Prime Remote. And as always, when you move, update your address and other information in DEERS. So the URL there for life events, tricare.mil/life-events/moving for more information. Let's talk about another example that's really important. So those that are retiring from active duty, so I'm on slide number 17, retiring from active duty are actually turning, and this also includes retired reservists that turn age 60 and become eligible for TRICARE benefits at age 60. So a change in status, in the sponsor status, means typically you're going to become ineligible for the TRICARE health plan that the sponsor and the family members are currently enrolled in. remember, all of our TRICARE health plans are based upon the availability of the plan, but it's also based upon the out-of-pocket cost. So if you retire from active duty, you are no longer eligible for and enjoy the active duty out-of-pocket expenses. You must, if you desire to have continued TRICARE coverage, you must enroll in a TRICARE retiree plan, and then you'll have the retiree out-of-pocket expenses. Generally speaking, once the military services notify DEERS that you're no longer on active duty, in general, DEERS then terminates, as of your retirement date, your enrollment in a TRICARE health plan that has active duty family member costs. For the active duty member, you are terminated from all TRICARE coverage. And so it's really, 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 really important when there's a change in sponsor status to retiree that within 90 days or earlier, within 90 days of the retirement, new retiree and the family members must elect to enroll in a TRICARE retiree health plan if that's what you desire. So on slide 18, just to re-emphasize, when you retire from active duty or a retired reserve member hits age 60, the coverage you previously had disappears as of the retirement date. If you want no break in coverage, you must notify the contractor that you would like to enroll in a retiree health plan within 90 days, and there will be no break in coverage. So the coverage that you sign up for, the retiree coverage, will start the day after you ended your active duty family or active duty member coverage. If you do not enroll in retiree health care coverage within 90 days, you're likely only eligible for care at military treatment facilities, military hospitals, and clinics on a space available basis. So again, for those that are retiring, please make sure that if you desire to continue to have TRICARE coverage, particularly with no gap in coverage as you leave active duty or retired reserve status, that you sign up. Let's talk about marriages. So on slide 19, a change in marital status is a QLE, both for marriage and also for divorce. For those that are military sponsors, it is your requirement by regulation and law as a uniform service sponsor, if you have a dependent that loses eligibility for coverage, it is your responsibility to notify the nearest military personnel office or rapid site that a member of your household is no longer eligible for care. In the event if it's a divorce, the military personnel office would like you to bring a copy of the divorce decree or dissolution or some evidence that the marriage no longer exists. And bring in the military ID card of that individual as well. All right? We will not know that until someone tells us that, tells the personnel community that. And for military sponsors, that is your responsibility. Okay, so of a change in marital status, whether it's a divorce or a new marriage, you have 90 days from the date of the marriage or the divorce to make any changes to the TRICARE health plan coverage of that new eligible beneficiary. Remember, children and stepchildren are eligible to receive TRICARE benefits following a marriage. Children of the sponsor upon a divorce remain eligible to be enrolled in TRICARE TRICARE coverage until they age out. However, upon a divorce, if the stepchildren are not the natural child of the military sponsor, the stepchildren lose TRICARE coverage as of the date of the dissolution of the marriage. The TRICARE contractor cannot help you enroll your newly eligible family members into a TRICARE health plan if they are not registered in DEERS. They'll be polite, they'll be pleasant, but they're just going to refer you to go to a military personnel office or to a rapid site to get that done. The coverage that are available to these newly eligible beneficiaries due to marriage depends on where you live and on your status. And again, go to any ID card office, rapid site, and bring marriage certificate, birth certificate, Social Security card, and photo ID. You may need more than one. Again, my recommendation is call the military ID card office, the rapid site, the personnel office, and ask them exactly what documents you need, and to make an appointment. On slide 21, let's reemphasize, keep your DEERS record current. The military health system depends upon the information in the DEERS database to determine eligibility and to show which health plan you're enrolled in. So please, 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 make sure your information in DEERS is updated. For example, during this open season, we sent out over 4 million postcards, and we got about 5% of them back because the post office could not deliver them. Our ability to communicate you, the military members and family members, is directly related to the veracity of the information that's in DEERS regarding your mailing address, your phone number, and your email address, and if you choose to let us use that, right? We want to communicate with you. Our contractors want to communicate with you, but we depend upon the information in DEERS to be correct. So please, please, please make sure you keep that uptight and right. So if you have concerns, Defense Manpower Data Center toll-free number is there. And how to update your contact information, go to ID card office. You can log on to MilConnect. You can call DMDC, or you can fax them. TRICARE.mil/DEERS is a one-stop place to go to get all your questions answered about how to interface with DEERS and how to update your information in DEERS. Next slide, 22. Do keep up with the TRICARE changes. The TRICARE program and TRICARE benefits do change from time to time, and we strongly recommend that you as a military beneficiary keep up to date with what his changes are being made to the TRICARE program. There's the website for open season. Another good one to sign up for, when you go to tricare.mil/changes, you can sign up to receive information for that. There's information about our Take Command. And also, finally, at the bottom of the slide, if you'd just like to get information by email whenever we have updates on TRICARE news and changes, we strongly recommend you sign up at the tricare.mil/subscriptions. So I've covered a great deal of information today. We talked about last chance until 31 December to do open season enrollment. We talked a little about differences between TRICARE Prime and TRICARE Select. And finally, we talked about effective 1 January 2019, and for all years forward, how and when you might elect to enroll in or change your TRICARE Prime or Select coverage, either during the annual open season period or when you or a family member experience a qualifying life event. And with that in mind, Stan, I'm going to turn it back to you and open the floodgates.
Okay, thank you, Mark. First question reads, my husband will be turning 60 and will start to collect retirement pay. He is currently retired reserve, I think, and we do have TRICARE. Once he turns 60 in February, can we enroll in TRICARE?
Absolutely. The answer is yes. Great question. So the member is currently retired reserve, and sounds like he's enrolled in TRICARE Retired Reserve, which has a, the gray area reservist is this population is called, have to pay full premiums for the TRICARE Retiree Reserve coverage. But hitting age 60, he must apply for the benefits, so he needs to work through his reserve component personnel office to make sure that they are putting in to the paperwork necessary to identify to DEERS that effective age 60, he has complied with the statutory and regulatory requirements to be placed onto the full retired list and be eligible to collect TRICARE full military healthcare benefits as a retiree. That also means when you send in that paperwork, you're going to get your retiree pay, which is a good deal. But what we have found is in some instances, If you don't contact them, they're not going to initiate the retirement. So a couple of months prior to turning age 60, we strongly recommend the retired reserve member reach out to his reserve component personnel office and say, sign me up. And then once they've notified DEERS that you are turning age 60 and you are entitled to TRICARE, at that time, please call the regional contractor and elect to enroll in a plan you're going to find markedly cheaper than what you're paying today. Next question.
And Mark, just a follow-up to that question. They corrected and said that we are not enrolled in TRICARE right now.
That's okay, so that's fine. So if you're not enrolled in TRICARE Retiree Reserve, but you're a gray area reservist, when you hit age 60 and the personnel office has sent in the appropriate electrons into DEERS, then again, call the contractor and elect to enroll in a coverage retiree health plan that's available to you in your area.
Okay, thank you. Next question reads, what happens if the member does not update DEERS with their address change before they call the contractor to change their enrollment?
So if you don't update DEERS with your change of address, the contractor can take that and enter it into DEERS for you as part of the enrollment transaction. We'd just like to train you to do that yourself because that's your responsibility, not actually ours. And so this is a good thing to say that, open season enrollment and qualifying life events are something that isn't new to the civilians. This is something they do every time they get new employment, and every year they get to elect to make a change. So this is new for us as military beneficiaries and retirees and active duty service members. So yeah, we do want you to contact DEERS and update it because we want to train you to do that, because that'll also prompt you to say, wonder if I need to make a change to my coverage, or maybe my newborn should have healthcare coverage. That would be a good thing. Next question.
Next question reads, what qualifies as injured on active duty for a QLE? What type of injury are they referring to?
So typically this is for selected reserve members where they have a line of duty determination and they need authorization for care during a specified time.
Okay, thank you. Next question. How and when do I make enrollment fee payments if I enroll during open season?
So you can do it a couple of different ways. You can fill out the enrollment form and authorize either funds coming out of a checking or savings account or charged to a credit card. You can call the contractor and elect to enroll, or with the enrollment forms, other than for young adult, you can also elect to pay your enrollment fees by allotment. You can call the contractor, you can pay by allotment or credit card or withdraw from a checking or savings account. And you can elect to do that, you would like to, how you might want to pay through the beneficiary online tool, but the contractor is going to have to reach out to you and validate some more stuff. In effect, the easiest way to do election of enrollment is to call the contractor and have however the information necessary needed to affect your enrollment when you're talking to them on the phone.
Okay, next question. Does this also include dental and vision?
No, it does not. So let's talk quickly about that. So the dental insurance for military retirees, survivors, and their family members, and vision insurance for most everybody else who is eligible to enroll in a TRICARE health plan, that's offered through OPM. And so their open season ended yesterday, or the 10th rather, the 10th of December. We have been informed by OPM that they may allow belated enrollments into FedVIP retiree dental insurance and vision insurance for most military beneficiaries, except active duty service members. Where you should go for information is benefeds.com, benefeds.com, and where you'll get more information about the vision and the dental insurances offered through FedVIP. Next question.
Next question reads, I'm retired from A&G and turned 60 in August 2019. I'm already in DEERS, so do I still need to contact my local DEERS office, or can I just sign up with TRICARE when I turn 60?
So, because you're referring to age 60, I'm going to assume that you're a gray area reservist or a retired reserve member. As we said, if you're a retired reserve member approaching age 60, about 3 months or so prior to turning age 60, contact your reserve component personnel office to make sure that all the paperwork is in place for you to have them report to the DEERS database that your retirement date is effective age 60. Once that's done, then yes, you could then call the TRICARE contractor to enroll or do one of the ways to enroll in a TRICARE health plan. Next question.
How long does it take for retirement status to reflect in DEERS? We have had members call the day before their retirement to enroll in a plan, but they are still not showing eligible for retired plans in DEERS.
Excellent question. Thank you for the question. So in working with the 7 uniform services and the 7 reserve components of the uniform services, we have discovered that in certain instances, the uniform services are not reporting the retirement date in a timely manner. And in some cases, they're waiting for the pay center to report your retirement date to DEERS effective when you have your first military retirement paycheck. So we're working with the uniform services to have them report to DEERS in a more timely manner. We hope at least 90 days prior to your retirement date, so that eligibility date and the date you're actually a retiree will be available to the contractor so you can proactively elect to enroll in a retiree health plan so that when DEERS turns off your active duty or retired reserve coverage, that your retirement coverage will just kick in with no gap in coverage. Until we get that done, there's a couple of things. There's probably the best thing you can do is to ask your uniform service to transmit the retirement date earlier than what they usually plan. The other way you can do that is you can take evidence of your retirement, your DD Form 214, and or a copy of your retirement order issued by your uniform service to a military ID card, Rapid Flights personnel office, and they in turn can issue you your new retiree ID cards. And when they do that, it actually updates DEERS with your retirement date, in which time you can then call the contractor and do other mechanisms. We are aware of this. We're working closely with the uniform services to make this better, but in certain instances, we are aware that some of the uniform services and their reserve components are not reporting the retirement date in a manner to which it would allow you an easy way to elect retiree coverage upon retirement. Next question.
Okay, my daughter just joined on 11/1/2018 the VT Army National Guard as an M-Day soldier. Can she sign up for TRICARE within 90 days of her enlistment, 11/1? And if so, is there a dental coverage option too? She will go on active duty for training effective 1/22/19 for a year. So going on active duty 1/22 will be a CLE.
Okay, so here's the deal. So reserve component members, National Guard or the selected reserve, depending on their status. So let me say it a different way. Your daughter, when she is called to active duty for more than 30 days, DOD's on the hook to pay for all their, either provide or pay for all the care they need from a civilian provider, both medical and dental, right? So for the period of active duty, we require active duty service members to work through the local military treatment facility at her base of assignment to get all the medical and dental care that she needs while she is on active duty. When she is deactivated from active duty and goes back to being a National Guard member not on extended active duty, she is eligible to do a couple of things. One is she's eligible to, as long as she doesn't have federal employee healthcare benefit program eligibility as a civil servant while she's in her reserve status, she can elect to enroll in TRICARE Reserve Select coverage, either for herself or if she has eligible family members, purchase a family plan. And while she's enrolled in TRS, she's also eligible to purchase the vision coverage on from OPM. The change in sponsor status when she goes on active duty, and particularly when she deactivates, is a qualifying life event, right? And so when she goes on active duty, DOD is required by law to provide everything she needs for her medical and dental care. When she gets deactivated, and if she purchased TRS coverage, she is also eligible to purchase the vision coverage. As a selected reserve, as a National Guard member not on active duty, she can elect to get her medical coverage anywhere else. She can purchase it from us, or she can get coverage elsewhere. For example, she may be have a civilian job during the week, and her employer offers her civilian health care coverage. So selected reserve and National Guard members have options that the active duty folks don't have. All right, and so that's right. So for when they're not on active duty, she and if she has eligible family members can also purchase TRICARE dental plan, dental insurance, which is offered by the Department of Defense. Next question.
All right, thank you. Do I have to re-enroll to keep my TRICARE coverage for the next year?
No. If you're happy with your plan, we're going to roll it over.
Okay. Next question. Can we enroll in the dental or vision programs? If so, would I be able to get pamphlets for each program adheres? It's hard to compare different options on the computer.
So you can go to thebenefeds.com. There you can actually, if you want to have more detailed information for each of the dental plans and vision plans, you can download a plan description for each of those, or you can call the FedVIP contractor and talk to them. Next question.
What if I change plans to TRICARE Select and now realize I want to go back to Prime?
Quick, before December 31st, call the contractor, and they will be happy to take care of that for you. But if you let it ride past 31 December, 1 January, you'll be stuck where you are, right? So if you're unsure, check out the plan information, compare the options, and if you think you need to make a change, please do so before December 31st.
Okay, next question. What happens if a member calls to enroll in a plan, but they are beyond the 90 days from the QLE? What message should these members be told, and what happens if they wish to fight the decision to not allow the enrollment?
So generally speaking, these are the rules under open season and qualifying life events. If you believe that the contractor or the government has caused you an exception, then you can talk to the contractor, and they in turn will talk to the Defense Health Agency program management folks. But in general, please comply with the open season requirements. They are required by law and regulation. Next question.
Okay. If I move within the same region from a prime location to another, do I need to re-enroll?
No, you don't need to re-enroll, but you likely want to make a change to your primary care manager. So again, contact the contractor, fill out a form, go to the BWE website. It's not a plan change. You're just electing to make a PCM change. So, and PCM changes, by the way, can be done at any time, right? It's only when you move from either prime to select or select to prime that is an open season and a QLE thing. All right, next.
Okay, and that is the last question, Mark. So I would like to thank you for sharing information related to this very important topic. I would also like to thank our attendees for participating in today's webinar. If you find yourself having questions after the webinar is over or if you were unable to get a question answered today, please contact your regional contractor. Also, many of the answers to questions related to the TRICARE benefits can be found on the TRICARE website at tricare.mil. Let's see here. So, thank you all for joining us, and have a great day.